We're thrilled to have you join us today as we learn, share, and work together towards a healthier future. Before we start, we're reminding everyone that the views and opinions expressed in this webinar are those of the speakers and do not necessarily reflect the official stance of the Health Promotion Program, the National Institutes of Health, its affiliates, or its partners. And to maximize the limited time we have together today, please take note of the following house rules. Please keep your microphone muted unless asked to speak. Please message any of the organizers for assistance with any technical concern. For any questions directed to the panelists, you may type this in the chat later on or reserve them during the Q&A portion. And during the Q&A portion, kindly raise your hand to be acknowledged. Turning on your camera is optional, but we encourage it to create a more interactive environment. This webinar is being recorded and will be uploaded to our social media platforms. By staying in this Zoom room, you consent to having your likeness recorded. To formally open our event, let's hear the opening remarks from Dr. Catherine Ann Reyes, Research Assistant Professor and Program Lead of the Health Promotion Program at the UP Manila National Institutes of Health. Dr. Cathy, the floor is yours po.
Magandang umaga sa inyong lahat. So good morning to everyone joining us today, whether here on Zoom or through our live stream. So we are happy that you join us today. So on behalf of the Health Promotion Program, we are based at the National Institutes of Health, University of the Philippines, Manila. I would like to warmly welcome our distinguished panelists, reactors, fellow advocates, policymakers, researchers, and all participants to this timely panel discussion. Tobacco and nicotine products continue to pose a serious threat to public health, contributing to preventable diseases and deaths in the Philippines. We have had progress, but despite this, the tobacco epidemic persists, which really requires from all of us sustained and collective action from all sectors of society. So having you here with us, we will consider this that you care about this issue. So we would like to share this space so that we can learn more and be empowered in our advocacy activities. So today's event, this is themed Unmasking the Appeal, Exposing Industry Tactics on Tobacco and Nicotine Products, aims to shed light on the realities of tobacco and nicotine use, debunk myths, and explore how we can strengthen tobacco control policies through evidence-informed approaches. More importantly, this discussion provides a platform for knowledge exchange between our researchers, policymakers, and advocates. And this will allow us to transform research findings into actionable policy recommendations and community intervention. At the same time, this interaction and others similar to this will also provide ways for researchers to listen and to hear and to determine what questions need to be answered through research. So let us take this opportunity to listen, learn, and collaborate as we work together towards a healthier, smoke-free Philippines. Thank you, and I wish everyone a meaningful and productive session.
Thank you very much, Dr. Cathy. We are also honored with a special message from Dr. Gloria Balboa, Assistant Secretary of the Department of Health. She's the cluster lead of the Health Regulations and Facility Development Cluster and head of Integrated Resilience Office and Global Health Office.
Good day, everyone. On behalf of the Department of Health, I extend our deepest appreciation to the UP Manila National Institutes of Health Health Promotion Program for organizing today's critical event on unmasking the appeal, exposing industry tactics on tobacco and nicotine products. As we mark National No Smoking Month and the World No Tobacco Day, we are reminded that the fight against tobacco and nicotine products is far from over. These products continue to take lives, fuel addiction, and place an enormous burden on our health system and our society. Let us be clear. Tobacco and vapor products are harmful. They are deadly, and they are deliberately marketed in ways that endanger our youth. The tactics used by the tobacco and vape industry are insidious. They come in the form of flavored products designed to taste like candy. They use vibrant, eye-catching packaging and device designs that look like USBs or juice boxes, intended to deceive and attract the young. Even more alarming is that 98% of cigarette retailers located within 100 meters of schools sell single-stick cigarettes, a direct attack on our children, making tobacco more accessible and more affordable than ever. This is not an accident. It is by design, and we must not be silent about it. We know what works, and we must double down, and these are the topics that would be discussed by our speakers and panelists today. First, we must strengthen tobacco packaging regulations. Graphic health warnings are proven to be effective deterrents, but they must be bigger, bolder, and clearer. The next step is plain packaging, removing all the branding and visual appeal that lures the next generation into addiction. Second, we must confront the tobacco industry's interference. They adapt their strategies to stay ahead of regulation, to stay visible in the market, and to stay influential in policy spaces. We must remain vigilant and protect our public health policies from their manipulation. And third, we must make a call for stronger enforcement of our laws against illicit tobacco trade. Taxation is not just a fiscal policy. It is a life-saving intervention, especially for young people who are more sensitive to price changes. Higher prices mean fewer users. Today's event is a call to action, a call to expose, to resist, and to protect. Let us stand unified. Let us say, do not start. Stop use, advocate. Let us build a Philippines where the next generation is free from the grip of tobacco and vape industries. Dahil sa bagong Pilipinas, bawat buhay ay mahalaga.
Thank you very much, Assistant Secretary of Health, Dr. Gloria Balboa. For this webinar, we're honored to have Sir Rodley Desmond Daniel M. Carza as our moderator and reactor for the panel. Sir Rodley is a former director at the Department of Health, where he served for 12 years, advancing health policies and systems to promote health equity and universal health care. He was instrumental in the development of national strategies focused on health promotion, disease prevention, and fostering intersectoral collaboration to support healthier public policies. Currently, he's a consultant for the Ateneo Policy Center and Vital Strategies on Tobacco and Alcohol Control, where he continues to influence the landscape of health promotion and disease prevention in the Philippines. Sir Rodley, the floor is yours. Thank you.
Thank you, Rainier, for that kind introduction. Isang malusog na umaga po sa inyong lahat, lalo na sa mga kasama natin dito sa Zoom at tagapakinig natin sa ating iba't ibang social media platforms. Again, I am Roddy, and I'll be moderating this session. But before we proceed, I would like to extend my congratulations and thanks to the Health Promotion Program of the University of the Philippines National Institutes for Health for organizing this event and having this very important discussion, no, in recognition of our and celebration of our World No Tobacco Day and No Smoking Month. And today we have three interesting topics that are very important for us policymakers, academics, and even the general public, no, to be part of. And each of the presentation today will be presented by experts are given 10 to 15 minutes to do their presentation. And at the end of the presentation, there will be an opportunity for us to ask questions. So please feel free to type in your questions in the chat box, or later on during the Q&A portion, raise your hand and shoot your question. Our first topic will be on tobacco packaging, and allow me to introduce my colleague from the Ateneo School of Government, Mr. John Rafael Arda, or JR as he is more commonly known, who will present the topic on unmasking the appeal of tobacco packaging. JR has been working in tobacco control for more than 5 years now, co-authoring different papers on tobacco control policies, especially graphic health warnings and plain packaging. In his time in the Ateneo School of Government, he has participated in various tobacco control activities supported by the International Union Against Tuberculosis and Lung Disease, Vital Strategies, and the Department of Health on capacity building, evidence generation, and health promotion. Again, let's welcome Mr. John Rafael Arda. JR, you have the floor.
Thank you, Sir Rodley. Hello, good morning, everyone, and thanks for having me here today. For this part, I'd like to talk about how, well, despite having tobacco control measures in place, there's still a number of ways that the tobacco industry exploits us Filipinos through the use of advertising and promotion that influences behavior and perceptions related to tobacco and nicotine products. But first, it's important to maybe reframe first, why we've put these tobacco control measures in place in the first place. Allow me to reintroduce some numbers that show how dangerous tobacco really is to all of our health. So, let's look at the numbers related to the tobacco epidemic. The tobacco epidemic is, as many would put it, an epidemic that runs rampant despite evidence pointing to nothing but it being harmful to us as human beings. Of the 22.3% of the world's population back in 2020, they use tobacco products. More than 8 million of them die yearly from tobacco-related diseases, including those exposed to secondhand smoke. So in the first place, you don't even need to be a user, to sort of get sick from it and then enter the possibility of death. Even if it doesn't result in death, there is the costs that are incurred throughout the length of your exposure to tobacco-related diseases, both from economic losses and then the healthcare costs that are incurred because of the disease as well. In a way, it kind of takes from a lot of different futures, both individually and from your country as a whole. Despite this, however, no matter how tragic everything is, it is still preventable. The Framework Convention for Tobacco Control, or the FCTC, developed a set of tobacco control measures called Empower that helps curb the influence of tobacco products on the population by targeting different aspects of tobacco use. As you can see from the letters, each of them stand for one particular aspect related to tobacco, such as its use, cessation, advertising and promotion, and also the use of taxes that help make existing standards be less tobacco friendly and be more health oriented. Of these, one of the most important ones that people are usually exposed to are the measures under W, or warn about the dangers of tobacco. And the central measure under this is what we would call the graphic health warnings. Now, everyone should be familiar with graphic health warnings because they are, well, pretty much in every available cigarette pack out there. Even if you're not a user, no, chances are you've seen some form of media that portrays the different effects of tobacco that are possible to incur because of its use. And its effects on the use of tobacco in general cannot be understated. If we compare the prevalence of current tobacco use from 2009 to 2021, it's evident how big of a proportion of the population have decided to either stop or to avoid just using tobacco in general because of its harmful effects as depicted in these warnings. Beyond that, now we've also adapted a number of tobacco control measures that help curb it even more, which includes the sin tax. Of course, despite this, there are still more than a million, millions of users within the country, which means that there's still much work to do when it comes to curbing tobacco use. But the impact of these measures is undeniable and can only get better with stronger, more effective measures in the future. However, current tobacco industry tactics are threatening to undermine the work that tobacco control advocates have been able to achieve. Because if we look at the youth and tobacco product e-cigarette use depicted in the 2019 GYTS, an alarming 10.8% of students currently smoke tobacco, while 10% of the youth aged 13 to 15 currently smoke cigarettes. Now, this is alarming specifically because the use of tobacco products shouldn't even be available to students or the youth in the first place because there is an age restriction. However, going through these surveys, there are users amongst them, and it's alarming that it's at least 10%. When asked about why they use it, or why they find it nice to use them in the first place, they mention reasons such as social, novelty, and pleasure factors. Let's try to break that down. What do these factors mean? Well, social, being that the cigarettes or other tobacco products are seen as a recreational device that they can share with peers. The novelty being the idea that it's hip or new or that it helps them look cooler. And then pleasure factors, meaning that its use is also found to be pleasing and fun, particularly because of the materials that's inside these products. Now, notice how they frame these reasons. It's very similar to how a lot of others in products, such as alcohol or recreational drugs, are touted to provide the same factors to consumers. They're seen as social, they're seen as fun, etc., etc. In a way, having those kind of ideas be proliferating allows them to sort of penetrate the mainstream, and that's the danger of it all. And a big part of why this is dangerous is because of the way they use advertisement to control consumer psychology. The use of colors in particular help evoke particular imagery associated with various ideas. And if you see a product under that color, you associate the product with that particular idea. Same thing with the use of images itself related to the tobacco product. If you see this particular e-liquid as something that's within fruits, so you imagine it as fruity, as fun, or maybe even delicious, if you think about it, because of the way we perceive fruits in general. That's a danger of letting tobacco products and their promotion proliferate without any regulations, which is why we've adapted particular policies to help curb that. The GHW law and then the resulting administrative order that places particular mandates on the use of images that warn people about their or about the tobacco products bad effects on health. Beyond that, we've also implemented things such as flavor regulations. Although there isn't any for flavored tobacco products such as cigarette and cigars, there are some for electric nicotine delivery systems, or vapes, or other related products in general, through to existing regulations today. This particular ban restricts flavors to only be menthol and tobacco, which we'll get into again later. So why are these important details to consider when it comes to the tobacco industry's tactics? Well, if we talk about compliance, no, using a GHW compliance list annexed in these regulations, ASO conducted a study in 2023 that looked at how many products actually complied to these regulations. And we found that amongst tobacco products, only 5.50% of the sample that we've collected are completely compliant to the checklist included in the law. As for the other products or other tobacco products, only 3 out of 313 were compliant, or 0.96%. Going into flavors, amongst tobacco products, 55.66% have flavor descriptors, which, if we extend to the vapes and the other nicotine delivery systems, 89.46 of them have flavor descriptors, even though regulations say that we can only have menthol and tobacco, no, as the flavors that are legally described within the packaging. If you boil it down to the flavors itself that are represented within these products, these are how they're um, partitioned. No? If you've noticed amongst the vape particularly, they have things such as colors, fruits, concept descriptors, beverages, sweets, or all things that particularly attract the youth. Which is why if you notice, amongst users of vapes and other electric nicotine delivery systems, the youth is a very prominent population, no, that is exposed to them. This is because a lot of the flavors, or a lot of the way they're packaged, a lot of their colors attract what well is considered attractive, no, to the youth, which is why they're particularly vulnerable to that, and they end up becoming one of the main users of that particular brand or particular category of tobacco products. Given all of this, it's apparent that despite existing regulations, the tobacco industry is not really doing its best to abide by these regulations. There's a lot of non-compliant products, either because of manufacturing, errors in manufacturing, or negligence on their parts. There is a need to kind of change this, of course, to avoid exploiting particularly vulnerable populations to these kinds of tactics, especially the youth. So what now? What happens given these numbers? Since 2013, there hasn't been any formal assessment of tobacco industry compliance regarding these regulations. Therefore, we need stronger monitoring and enforcement, especially in far-flung areas where things such as tobacco or illicit tobacco trade proliferates because of the lack of government surveillance. There's also a lack of standardized packs that make it hard to actualize how e-cigarette products, no, in general, comply to existing GHW regulations. So what are our recommendations, no, and challenges that we'll face regarding this? Well, the recommendation is, of course, stricter enforcement of the law, although its difficulty is related, no, to dependencies in the roles and responsibilities of implementing agencies, because it's not only, for example, DOH that handles these things, it's also DTI, the BIR related to tax stamps, etc., etc. There's also a need for regular compliance assessments given the rate of compliance among collected packs. Imagine if the government itself, no, were the ones to run that compliance test. One particular thing that we find important, no, in this line of work is the idea of evidence-based policy making. Beyond just talking about the results of these studies, we want to help it reach, no, people who will use them the most. That's why in disseminating research, we want to make sure that the message included in that research is clear, not only to us, but also to other people as well, especially lawmakers. For this, we have different avenues and tools that we can use for policy dialogue, such as policy briefs and stakeholder presentations. We also want to work with others to help fight against the tactics of the tobacco industry, because it's not easy to do it, of course, alone. So to end it all, no, for this part of the presentation, I want everyone to remember that no matter what is said, tobacco use is proven to be bad for our health. Therefore, what is best for everyone is to be less exposed to them as much as possible, even by second hand. As DOH has said, no, ang bawat buhay mahalaga, kaya protektahan natin sila. Thank you and good morning to everyone.
Thank you, JR, for that very enlightening presentation. It is indeed very alarming that despite having these policies, we see industries not fully complying with the requirement of the laws, particularly for graphic health warning. And in our context, wherein the traditional advertising is actually banned, tobacco packaging is a very powerful marketing tool, and tobacco companies rely heavily on packaging to attract users, especially the youth, as presented by JR. And they employ various color, shape, descriptors to mislead consumers into thinking that some products are less harmful. And as reiterated a while ago, they are not harmful. They're deadly, as mentioned by USEC Global BOA in her message. No, so I think it's very important that we highlight plain packaging actually works, and evidence actually support introduction of standardized packaging, which reduces the appeal of these products, increases the impact of the health warnings, and of course, support those who wanted to quit. So I think it's very important to us to actually support and enforce our policies, particularly the graphic health warning law, and advocate for plain packaging as part of a comprehensive tobacco control strategy. So thank you, JR, for that presentation. And to tackle equally important and concerning trend in tobacco control, allow me to introduce our second speaker, which will talk about illicit tobacco trade. So we have today Ms. Pia Rodrigo from the Action for Economic Reforms. Ms. Pia is the Advocacy and Communications Officer of Action for Economic Reforms, a policy advocacy group and economic think tank working on macroeconomic, health, and fiscal reforms. She leads AER's health policy program, specifically working on tobacco taxes, illicit trade, universal healthcare, and alcohol taxes. Again, please welcome Ms. Pia Rodrigo.
Thank you so much, Sir Rodley. Good morning, everyone. Very happy to be here and to share our advocacy on tobacco taxes and mitigating illicit tobacco trade with you. So I will be discussing combating illicit tobacco trade in the Philippines. And just to give a little bit of context, no, as to what illicit tobacco trade is and why it's so important that we guard against it. I'll be talking about the uh, the importance of sin taxes and what they have done to both our public health and our revenue. So, sorry. Next slide, please. I think it's not clicking. Thank you. So the Philippines is a global leader in sin tax reform. So we have been recognized by the World Health Organization as one of the countries with the most transformative tobacco tax laws. So in 2012, there was a very landmark tobacco tax reform, the sin tax reform, or Republic Act 10351, which completely changed the structure of our tobacco taxes. It earmarked at least 40% of tobacco taxes to universal healthcare. It increased the rates significantly, and it got rid of a very antiquated way of taxing tobacco from the past. And since 2012, we've had a series of wins. So there are three reasons why tobacco taxes work. So first of all, they are pro-health. The number one objective of tobacco taxes is really to curb consumption. So since 2009, which was right before the sin tax reform was passed, until 2021, the prevalence of smoking has fallen from 28.3% to 18.5%. So, of course, we can also look at the comprehensive package of tobacco control reforms that has been passed since then. But definitely, tobacco taxes are acknowledged globally as the most effective um, measure in curbing consumption, because as the prices go up, less people are inclined to start smoking, especially those who are price sensitive, the young and the poor. Secondly, tobacco taxes are pro-revenue. So tobacco taxes are specifically allocated towards universal health care and towards tobacco producing provinces to encourage tobacco farmers to shift towards more sustainable forms of livelihood. So the tobacco tax collection since 2012 have actually increased fivefold in nominal terms and threefold in real terms from 2012 to 2021. Thirdly, tobacco taxes are pro-poor. So despite some arguments that tobacco taxes target the poor or are regressive, the reality is that the revenues are actually allocated to benefit the most marginalized. So, one example of this is the combined budget for the Office of the Secretary of the Department of Health, as well as PhilHealth, has actually increased by 422% from 2013 to 2022. So, in terms of actually augmenting our DOH budget, sin taxes or tobacco taxes have really done a lot for us. And the rationale for taxing tobacco is really, in part, the economic burden. So, if we're looking at the total direct and indirect cost of smoking, which means how much money we lose in terms of um, lives lost and years of productivity lost to those who die due to tobacco-related diseases or those who are rendered disabled because of tobacco-related diseases, as well as the direct healthcare costs of these diseases like lung cancer and COPD. The total and direct and indirect cost of smoking is actually 749.6 billion pesos. And the tobacco industry continues to gain from this business, no? Euromonitor data shows that 453.3 billion is the tobacco industry's total revenue, and of which only 134 billion in that year went to tobacco taxes. So there's a huge loss to society, which is why we need to tax tobacco. And what I'll be discussing today is illicit tobacco trade. So this is an excuse or a justification that the tobacco industry constantly brings up. Their argument is that because we have raised tobacco taxes so much, um, it has widened the gap between the price of legal tobacco or the registered tobacco companies which pay taxes, and illicit tobacco or tobacco that is produced without conforming to the regulations set forth by the DOH and the BIR. So this is an argument constantly brought up by the industry that we should not raise taxes because there is a direct correlation between the imposition of higher taxes to smuggling. But global evidence has shown that illicit trade is more of a function of poor tax administration rather than an increase in tobacco tax rates. And therefore, illicit trade can be neutralized by good governance and good institutions. So, studies in the Philippines have even shown that there is no evidence of a positive relationship between tobacco taxes and the size of the illicit cigarette market. And a World Bank study in 2019 showed that the level of smuggling is usually higher in countries that have lower cigarette prices. So these are also countries with lower tax rates than in countries that have higher prices. So another argument that the industry has been constantly using is that because of illicit trade, because of smuggled and illegal cigarettes, we need to avoid increasing tobacco taxes or even lower tobacco taxes. But the idea of doing away with tobacco taxes because of illicit trade is actually very dangerous. So it is not, this is a false dichotomy that we cannot have tobacco tax hikes because of illicit trade, because we can actually do both. We can raise tobacco taxes and at the same time address illicit trade because it undermines both the health and revenue gains of tobacco taxes. So the tax policy reforms need to be part of the comprehensive program to lower cigarette consumption, and tax administration and the tobacco tax reform should be viewed as complementary. So this is where the sin tax sabotage bill comes in. So advocates have branded this bill or House Bill 11360 as the sin tax sabotage bill because essentially it is undermining our public health and the revenue gains from the sin taxes under the guise of illicit trade, of solving illicit trade. So the gist of the bill is it lowers the annual increase in tobacco taxes from 5% to an alternating 2% and 4% every year. So essentially, it lowers the real tax rates and it fails to keep up with inflation and income growth, which is actually the point of the annual 5% increase. No? And by doing this, our tax regime will effectively encourage cigarette consumption, and at the same time, it will reduce our revenue collection. So, according to AER's projections, almost 2 million new smokers will start smoking if we lower cigarette prices, as outlined in the sin tax sabotage bill. The current status of this bill is it has not passed in the Senate. So only the House counterpart has passed. But we believe that this is a very detrimental bill to tobacco control. And advocates have been very vocal in their opposition. So what should we do instead of lowering tobacco tax rates? No? Effective enforcement and regulation are really the way to go to make sure that the primary goals of reducing smoking and funding public health initiatives are achieved. So, as I said earlier, that really the number one goal of sin taxes is to lower consumption. Of course, revenue is also very important, but if we sacrifice our revenue for our public health, then the goal of sin taxes ultimately will not be achieved. No, so I will just quickly go over the different kinds of illicit trade, um, and maybe uh, introduce some reforms that are needed to address illicit trade in the Philippines. So, just some reasons again why illicit trade needs to be addressed. It keeps cigarette prices artificially low. So in places like Mindanao, cigarette packs go for as low as 20 pesos per pack. When you compare it to the registered brands, those brands can cost 160 pesos to 150 pesos. So the gap is really so huge. And when you have these very cheap cigarettes accessible, it will undermine, of course, our public health efforts. Illicit trade is also anti-revenue. So if we do not collect the enough taxes from our tobacco excise taxes, there will be budget shortfalls that will affect public spending, especially on healthcare. And we need sustainable public funding for universal healthcare, as shown by the COVID pandemic and what we have been through in these past years. And then lastly, illicit trade is also anti-governance. So it weakens institutions that are responsible for law enforcement and tax collection. And an illicit market can also lead to increased corruption and criminal activity, as it is also seen that illicit trade is funded a lot of the time by terrorist groups and other groups participating in other illicit activities. So, what do we need to do to control illicit trade? We really need to coordinate control of the entire supply chain. So, from where the tobacco leaves are grown to the final purchase by the consumer, we need to make sure that we have a way to track everything. So this is the most effective way to reduce tax evasion. No? So what the literature suggests is that we have a comprehensive tracking and tracing system. So this is actually just an upgrade of the tax stamps that you can probably already see on every single cigarette package. Here in the Philippines, we do have a tax stamp system, but what is needed is to upgrade the track and trace system to make sure that every consumer can scan the QR code of their tax stamp and identify where their cigarettes were manufactured, who manufactured it, and ultimately to verify if they are legitimate, if they have paid their taxes, and if they are also compliant to the regulations set forth by the DOH and the BIR. So currently, these are the components of the track and trace system that are ideal for us to really be able to gain control of the supply chain. Um, and a very important factor, which I think is also relevant for today's discussion, is to make sure that the tax stamp system or the track and trace system is independent from the tobacco industry. Because in the past, they have had a history of trying to gain control of the track and trace system for their own interests. A lot of the time, their picture of illicit trade is very much inflated, no, compared to independent studies, because as I said, they use it as an argument to argue against raising tobacco taxes. So that's why it's very important that this is kept independent. And another important factor is to have better enforcement. So the Philippines has very porous borders, which makes it easy to smuggle in illicit cigarettes, especially through sea vessels. No, so the key is really to strengthen the coordination between the BIR, the Bureau of Customs, and other law enforcement agencies and local government units. The law is being enforced. No, and another observation is that a lot of illicit cigarettes come from our neighboring Southeast Asian countries such as Indonesia and Malaysia. So we need to pursue international collaboration to manage the expansion of illicit tobacco trade. And as I mentioned, the public should be able to participate also through verification and reporting mechanisms. So I think one last point, no, for this presentation is that the measures that I just mentioned, so upgrading the tracking and tracing system, and there's a bill actually that was filed and passed in the 19th Congress in the House of Representatives, which has all of these enforcement measures baked into it already. So it really aims to stop illicit trade at the source and to address enforcement, which is the number one problem. So we at AER and the tobacco control community are advocates of addressing enforcement instead of lowering tobacco tax rates. And we hope that we can continue having discussions on the correct policies to address illicit trade and make sure that we always combat the industry's narratives and make sure that we listen to the evidence on this very important issue. Yeah, so that's all from me. Thank you very much.
Thank you very much, Pia, for that eye-opening presentation. session, the tobacco industry indeed used fear of illicit trade to actually oppose tobacco control policies like higher taxes and plain packaging. So we really need to be very vigilant, especially there are bills filed to undermine our public health efforts. And thank you for highlighting the link of illicit trade and health and reaffirming that illicit trade is actually not just a trade issue, but also a health issue, no? But it is indeed the real issue. And thank you for highlighting the tobacco industry interference. Our panelists